Hello. हेलो
यस मैम।
स्लाइड शो हो रही है आप लोगों को?
यस मैम।
ठीक है जी।
थैंक यू मैम।
परवेज अली, रोल नंबर 124 ई ग्रुप। मेरे ख्याल से आपके पास अपना सेल फोन होगा तो आप वहाँ पे मैसेज कर सकते हैं, यहाँ पे करने की कोई जरूरत नहीं है। तो नेक्स्ट टाइम तो कोई भी जो है ना वो चैट बॉक्स में कोई मैसेज ना करें। Today we are going to discuss about the structures known as urethra and the prostate gland. So starting with the urethra, the structure of the urethra, it is a tube-like structures that help in the transportation of the urine from the urinary bladder to the external urethral meatus or external urethral opening. So by definition, the urethra is defined as it is an structures of the urinary system that helps in the transportation of the urine from the urinary bladder to the external urethral meatus. The structure of the male urethra, it is approximately 15 to 20 centimeters long, and it is divided into three parts. There are three parts of the male urethra. The first part is known as prostatic urethra. The second part is known as membranous urethra. And the third part is known as bulbar urethra, also known as penile urethra or the spongy urethra. So there are three parts of the male urethra. The first part, that is known as prostatic urethra, it is named because of its relationship with the prostate gland. It on either side of this prostatic urethra, the prostate gland is located. This part of the urethra is about 3 centimeters long, begins as a continuation of the neck of the urinary bladder. It passes through the prostate gland and then it continues with the membranous part of the urethra. So superiorly, it is continuous with the neck of the urinary bladder, and inferiorly, it continues as a membranous part of the urethra. It receives the ejaculatory ducts along with the ducts of the prostate gland. So there are two types of the openings of the ducts in the prostatic urethra. One of the opening of the ducts of the prostate gland, and second for the openings of the ejaculatory ducts. This part is the widest and the most dilatable part of the urethra. See in this figure, this is the urethra. The first part is known as prostatic urethra, that is related to the prostate gland. Superiorly, it continues as an extension of the neck of the urinary bladder, and inferiorly, it becomes continuous as the membranous urethra. And it is the widest and the most dilatable part of the urethra. The second part of the male urethra, known as membranous urethra, that is about 1.25 centimeters. This is the part that passes through the pelvic floor or the pelvic diaphragm. See again in this figure, here is the pelvic floor that is composed of the different type of the muscles. When the urethra passes from this pelvic floor, this part is known as membranous part of the urethra. So it is only about 1.25 centimeters in length. It is surrounded by, because some of the muscles of the pelvic floor surrounds the membranous part of the urethra and acts as a sphincter, known as the sphincter urethrae muscles. This part is the narrowest and the least dilatable portion of the urethra. So the first part is prostatic urethra that continues with the membranous urethra, and the third part is known as the bulbous urethra, also known as penile urethra, that passes through the penis. This part is about 15.75 centimeters long, and it ends at the external urethral orifice, and this receives the bulbourethral glands. So these are the three parts of the male urethra. Now the arterial supply of these three parts are different. The prostatic urethra is supplied by the inferior vesical artery. The inferior vesical artery is a branch of the internal iliac artery. Then the second part, known as membranous urethra, is supplied by the branch of the internal pudendal known as bulbourethral artery. The third part is supplied by directly from the branches of the internal pudendal artery. So these three part receives the different arterial supply. Prostatic part is supplied by the inferior vesical artery. The inferior vesical artery is a branch of the internal iliac artery. The second part is known as membranous urethra. This membranous urethra is supplied by bulbourethral artery, and bulbourethral artery is a branch of the internal pudendal artery. The third part, the spongy urethra or penile urethra, is supplied from the branches of directly the branches of the internal pudendal artery. The corresponding veins drains these areas, the different parts of the urethra. The nerve supply of the male urethra is by the prostatic plexus. When we apply that term, plexus means it's a network of the nerve that contains a mixture of sympathetic fibers, parasympathetic fibers, and visceral afferent fibers. The lymphatic drainage of the male urethra, the first two parts, the prostatic and the membranous parts, are drained by the obturator and then enters into the internal iliac group of the lymph nodes, while the third part drained by the superficial and deep inguinal lymph nodes. So there is a difference in the lymphatic drainage as well. The superior part is drained by the internal iliac group of the lymph nodes, and the third part is drained by the inguinal group of the lymph nodes and includes the superficial and deep inguinal groups. So these are the three parts of the male urethra. And if you see the continuation or extension of the urethra, so it's extends from the urinary bladder to the external urethral meatus or external urethral opening. Then the female urethra, it is relatively short as compared to the male urethra, and it's only about 4 centimeters in length. It begins at the same level at the neck of the urinary bladder and ends at the external meatus, where it opens into the vestibule, the area where it opens known as vestibule. That is the part of the perineum. At the sides of the external urethral meatus, there are small openings of the paraurethral glands that are corresponds to the prostate glands in the males. So there is no any further part of the female urethra. It's a short structure as compared to the male urethra. It extends from the neck of the urinary bladder and ends at the level of the external urethral meatus. The neurovasculature of the urethra, female urethra, it is supplied by the internal pudendal arteries along with the branches of the directly branches from the vaginal arteries and the inferior vesical branches of the vaginal arteries. So three types of the arterial supply from the internal pudendal, from the vaginal arteries, and the inferior vesical branches. The corresponding veins then drains the urethra and enters into the internal pudendal veins. The nerve supply of the female urethra arises from the vesical plexus and the pudendal nerve. These vesical plexus again contains the sympathetic fibers, parasympathetic fibers, and visceral afferent fibers. The lymphatic drainage of the proximal part of the female urethra is drained by the internal iliac group of the lymph nodes, while the distal parts drained by the inguinal group of the lymph nodes, especially the superficial inguinal group of the lymph nodes. So the lymphatic drainage is same as that of the male urethras, because the proximal parts again drains into the internal iliac group of the lymph nodes, and the distal part drains into the inguinal group of the lymph nodes. Then the prostate gland that is present in the males, and especially it is related to the prostatic part of the urethra. It is a fibromuscular glandular structure that surrounds the prostatic urethra. This is about 3 centimeters long and lies between the neck of the urinary bladder and urogenital diaphragm. See in this figure, this is the prostate gland that lies between the neck of the urinary bladder. Above is this structure, and it is related to the inferiorly to the pelvic floor or the pelvic diaphragm. The prostate gland is surrounded, because it's a type of gland, so it is surrounded by a fibrous type of the capsule. The gland has a base that is towards the neck of the urinary bladder. It has an apex that is towards the urogenital diaphragm. So this is the base of the prostate gland, and here is the apex. The base is towards the neck of the urinary bladder, and the apex is towards the urogenital diaphragm or towards the pelvic floor. The ejaculatory duct pierces the upper part of the prostate gland and opens into the prostatic urethra. So this is the part known as the prostatic urethra, and this one is the ejaculatory ducts. There are two ejaculatory ducts that passes from the posterior lobe or the posterior part of the prostate gland and opens into the urethra, prostatic part of the urethra. The structure of the prostate glands, first of all, the apex and the base. The base is towards the neck of the urinary bladder, and its apex is towards the urogenital diaphragm. The ducts of the prostate gland opens into the prostatic part of the urethra, and then there are different lobes of the prostate glands. There are about incompletely 5 lobes of the prostate gland. The anterior lobe lies in front of the urethra. How they are differentiated or how you can identify these lobes. The anterior lobe, the part of the prostate gland that lies in front of the urethra. That is indicated by the greenish color. This is the anterior lobe that lies in front of the urethra. This one. Here is the urethra. So in front of the urethra, this lobe is known as anterior lobe. This is the sagittal section, and this one is a transverse section. The median lobe, also known as middle lobe, is a wedge shaped of the structure of the gland that lies between the urethra and the ejaculatory ducts. The part of the prostate gland that lies between the urethra and ejaculatory duct. This lobe is known as median lobe or the medial lobe that lies between the urethra and ejaculatory ducts. The posterior lobe is the lobe of the prostate gland that lies behind the urethra and below the ejaculatory ducts. So here is the posterior lobe that lies behind the urethra and below the ejaculatory ducts. And there are two lateral lobes, the right and the left lateral lobes that lies on either side of the urethra. So in the transverse section, you can easily see these are the two lateral lobes that lies on either side of the urethra. So these lobes are important. There are 5 lobes of prostate glands. They are named as anterior lobe, median lobe, posterior lobe, and the 2 lateral lobes. The anterior lobe is the part of the prostate that lies in front of the urethra. The medial or the median lobe lies behind the urethra above the ejaculatory duct. Below the ejaculatory duct, the part of the prostate gland known as posterior lobe, and the 2 lateral lobes lies on either side of the urethra. If we see the neurovasculature of the prostate gland, it is supplied by the branches of the inferior vesical arteries and the middle rectal arteries. The corresponding veins drains the prostate gland and forms a type of plexus known as prostatic venous plexus that lies outside the capsule of the prostate gland. These prostatic plexus drains into the internal iliac veins. The lymphatic drainage of the prostate gland, it is drained by the internal iliac group of the lymph nodes, and the nerve supply, it is supplied by the inferior hypogastric plexus. So that is the today's topic, the urethra and the prostate gland that is related to the male urethra, especially the prostatic part of the urethra. Any question related to the topic? जी परवेज बोलें।
ब्लेडर सेम होते हैं या अलग अलग साइज के होते हैं?
जी
यूरिनरी ब्लेडर जो होते हैं मेल और फीमेल के अंदर, वो दोनों सेम होते हैं या डिफरेंट होते हैं?
सेम इन द सेंस ऑफ,
मतलब कि वॉल्यूम के सेंस में?
so that doesn't depends on the sex, that either it is related to the male or female. It depends on the distensibility and the amount of the urine that is present at that time. That's why it is surrounded by a type of the transitional epithelium that can modified according to the volume of the urinary bladder.
नहीं मैम, क्योंकि मैंने कहीं पे देखा था कि वहां पे लिखा हुआ था कि मेल के अंदर ज्यादा स्टोर हो सकता है यूरिन, जबकि फीमेल के अंदर कम होता है।
अच्छा एक पहले तो बात बताएं परवेज, आज आपने टॉपिक क्या पढ़ा है?
मैम यूरिनरी थोड़ा सा इससे पीछे में आ गया, वैसे हमने
बहुत ज्यादा पीछे चले गए हैं।
और मैम ये पूछना था, अच्छा चलें फिर इसको छोड़ देते हैं। मैम ये अगर आपने बताया कि यूरिनरी ब्लेडर वो, अच्छा यूरेथ्रा के अंदर ही वो वेन्स आती हैं, मतलब कि सीमेन वाली वेन्स आती हैं, वो वेसल्स आती हैं, तो ऐसा नहीं होता?
Ejaculatory ducts opens into the prostatic part of the urethra.
यस मैम, तो ऐसा नहीं होता कि ये पीछे चले जाएं ब्लेडर के अंदर?
क्यों?
मतलब किसी वजह से अगर सीमेन वगैरह रिलीज होता है तो वो पीछे नहीं जा
That
सकता?
is the normal anatomical position, and देखिए abnormality तो कुछ भी हो सकता है. We are discussing the structure of the urethra. That is a normal structure. We are concerned with that. If they located somewhere else, then it leads to a pathological condition.
ओके मैम, थैंक यू।
Any other relevant question to the topic?